Hello, my name is Michael Zlotnick, and today I am implementing mindfulness steps, which is a program that I will be implementing into the Naperville 203 and 204 school district. So, with the current state of this fast-paced world we live in, young minds are changing at a rapid pace. Kids have all different types of technology in the palms of their hands. Social media is very dangerous to young minds. With no regulations with kids and social media, we must be proactive by creating a detection and prevention program. Mindfulness Steps is a program created for the Naperville middle and high schools for students, parents, teachers, and coaches, and for the community. Naperville has a population of around 148,000 residents. 0 to 18 of them, or the 0 to 18-year-olds are around 40,000. The CDC states that 11% of children in the US are diagnosed with anxiety and 4% are diagnosed with depression. So with Naperville being one of the wealthier cities in the Chicagoland area, it has different problems than the usual. With an average household income of $148,000, there are higher expectations of the youth. As someone who grew up in Naperville, I have firsthand experience with the heightened levels with education and sports and expectation. This and other factors can create many different health challenges for these Naperville students. The goal of this program is to improve preteen and teenage mental health by focusing on promotion, prevention, and intervention. To start this program, we will try to create an environment where talking about mental health can be normalized. Majority of teens want to fit in and dislike to be different than their peers. To do this, we will have each student have a session with the school counselor once a semester. This creates a space where being open and honest about feelings is normal. It states here we will create a standard of care where exceptional financial capability translate directly to proactive, innovative, and personalized support for our preteen and teenagers. This foundation ensures that our youth are liberated from pressure of affluence and empowered to define success by their inner health, granting them freedom to reach their authentic potential. Our program goals, as stated here, is to bring awareness of signs and symptoms to this specific population. These kids are just starting to navigate the world and they need to learn how to handle their emotions and how to act. Stated here, 80% of middle and high school students will be able to identify 3 signs of mental health challenges and name at least 2 support resources. The other goal here is to successfully integrate community resources where all can be in collaboration to give immediate access to those who need. To measure this goal, we must achieve a 75% success rate in referrals from the youth to health provider where appointments can be scheduled within 7 days. Using the ecological model, we can understand student development with many different layers in their surrounding environment. At the individual level, health classes will focus on self-awareness. At the intrapersonal level, we will have teachers and coaches and parents being taught to look for signs and symptoms of mental health issues and to communicate with their teenagers. At the community level, we will gain the city of Naperville's support to reduce the stigma of mental health issues and create a safe environment for all. We will also host 5Ks and other healthy events where we can market living a healthy mental lifestyle. At these events, we can communicate to those about policymakers who support mental health bills and policies. Success will be defined by increased confidence of students and parents to understand what mental health is and to understand how to handle it. We will collect quiz scores, parent surveys, and data from counselor visits. We will also gather numbers on teachers and parents who participated in mental health training classes. To begin this program, we will create a poster to put around schools that will have a QR code on it that sends students to a website with resources and information on where to find help within their own environment or school. We will create an advertisement that sends a message to the student and is not an ad. This can be posted on TikTok and other social media platforms. The stakeholders for this program will be the school district, District 203 or 204, Endeavor Health, which is Naperville's main healthcare company, and the city of Naperville and high school clubs. So District 203 or 204 will oversee classroom implementation and counselors. That's on the personal level. They will teach students in health classes how to handle their emotions, what to look for, how to just live that healthy mental lifestyle. Counselors are the first line of defense, if you want to say. They will be talking to each student. They will be listening and continuing health plans if needed for these students, checking in on them. Endeavor Health, which is, like I said, the one of the main healthcare providers in the area, will give us that clinical expertise. There is Linden Oaks in Naperville, which is one of Naperville's mental health facilities. So if we do need that further continuum of healthcare needs, we can go to Endeavor Health. The city of Naperville, of course, we will need their community support and, of course, policy if needed. And then high school clubs I wanted to put, I think it would be great if the high schools could create some sort of club or um, I guess group where students can feel safe on their own and safe to talking to other students. Maybe this can be a club where there is no staff involved and students can relate more to each other. So as I stated before, we're going to put posters up in the schools and we will have TikToks and QR codes on these posters. I don't want the TikTok or advertisement on social media to feel like an advertisement. I want it to be a message where these teens can kind of engrave that into their heads. And that's why I put our slogan, as we've all heard before, it is okay to not be okay. Very simple, very powerful. I think that'll go well. Parents will gain awareness of this program through communication with the school, through coaches and teachers. And then, of course, there will be something on the school website that'll uh, send you to our website. And again, the website would be called Mindfulness Steps. So for the budget, as we can see here, the administrative director who will oversee the entire program, their job will be to plan and coordinate large operations and to manage the other positions. The program director will plan day-to-day or run day-to-day operations and teach the teachers, coaches, and parents about this program, so the signs and symptoms. Both these two positions will be in communication with school counselors and in Endeavor Health. To evaluate the program, we will need a data specialist to run the numbers and compare scores. I've allocated $3,000 for poster materials around the schools. Since social media will be the main attraction with gaining the youth's attention, we have allocated $10,000 to the website and social media advertisements. I would also like to host different marketing events throughout the community, so I put $25,000 into special events. As I stated earlier, 5K runs, having a booth at different um, community-wide events, just trying to get our name out there, our program out there. And as you see there at the bottom, finally, the largest amount of money goes to school support. This money could go to anything that the school needs in order to have this program and run this program smoothly. This number could change after a year of the program based on what is needed and was not. Now, we were given $500,000 to work with. There is still some money left over. Any of these numbers can fluctuate depending on the annual review, as I just stated, with the school support cost. So there is some money to play around with if we need to add something or take something out. This program is very self-run almost. It's getting the information out there to the parents, teachers, and students, and just going with it and letting the teachers and parents communicate with the students, continue to relay this message that it is okay to not be okay and to talk to people and seek help when needed. In conclusion, the implementation of this mental health awareness program represents a vital step towards supporting students' overall well-being and academic success. By providing opportunities for students to learn to have emotional regulation, self-awareness, and effective stress management skills, schools must build or can build a healthy environment where students can learn in a positive school climate. Prioritizing mental health demonstrates forward thinking and a commitment to nurturing well-rounded individuals who will be prepared to meet current and future challenges. With this program, we are investing in the student, parent, and overall company. Thank you for listening.